Good afternoon, guys. I have discussion A for you. We're discussing end of life conversations that build trust and understanding. Okay? Um this is for people that, let's say, just get diagnosed with a serious illness that means end of life for them. Okay? So you have to find, you as a person who does end of life care, have to find a way to get things across to them that make sense for them to understand. So you sit down with the patients or clients, and you explain each part of the end of life process to them so they understand. And before that, you explain their illness. You explain the whole thing to them with compassion and dignity, folks. Okay, so that is what today's discussion is going to be for A. So please join me for today's discussion. Here we go. End of life conversations that build trust and understanding outlines a compassionate framework for clinicians to navigate sensitive discussions with dying patients and their families. Here are the key takeaways. Four-part framework by Dr. Richard um, Bolaban. Bolaban. Starting with support. Build trust by showing empathy and compassion. Be be authentic and approachable. Use eye contact, gentle touch, and respectful language. Encourage patients to encourage patients and families to share their stories and spiritual practices. Clarifying roles and concerns. Define your role as a supportive uh, presence. Ask what the patient's fear fears most or wants to avoid, e.g., suffering, being a burden. Appoint a surrogate decision maker early in the conversation, making the prognosis clear. Be honest and direct about the medical outlook. Repeat explanations as needed to ensure understanding. Reassure patients that comfort, care, and pain relief will be prioritized. Easing fears. Address common fears like pain, abandonment, and loss of dignity. Explain what to expect and how care will be tailored to their needs. This approach emphasizes empathy, clarity, and respect, helping patients feel heard and supported during one of life's most vulnerable moments. If you'd like, I can help you craft your own version of this framework for specific settings or audiences. Absolutely. Dr. Richard Ballban's 4-part framework for end of life conversations is designed to foster trust, clarity, and emotional support. Let's unpack each part with more non and practice and practical guidance. One, sharing, starting with supports. This is all about building a rapport and emotional safety. So, empathy, acknowledge the patient's fear, grief, or uncertainty. Simple phrases like, I know this is a difficult time, can go a long way. Be authentic. Use eye contact. Sit close. Speak gently. Even small talk or humor can help humanize the interaction. Honor their story. Invite patients and their families to share their experiences and values and spiritual beliefs. Respect rituals. Support any spiritual or cultural practices they find comforting. Clarifying roles and concerns. Here's here you define your role and explore what matters most to the patient. Position yourself as a guide. Let them know you're there to help, not just medically, but emotionally. Ask about fears. What worries you most? Or what do you want to avoid? Can reveal deep concerns like pain, dependency, or being a burden. Appoint surrogates. Appoint a surrogate. Identify someone who can make decisions if the patient becomes unable to speak for themselves. Making the prognosis clear. Transparency is key, but it must be delivered with compassion. Be honest and direct. Avoid medical jargon. Use clear use clear language like the treatments are no longer working. Repeat and check understanding. Patients may need time and repetition to absorb difficult news. Reassure them. Emphasize that comfort care and pain relief will be prioritized, even if creative treatments is no longer possible. Ease fears. This final step is about emotional reassurance. Address common fears. These often include pain, abandonment, loss of dignity, or being forgotten. Describe what to expect. Explain what to expect. Describe how care will be tailored to their needs and how you'll support them through each stage. Stay present. Let them know they won't be alone. Your presence is part of the care. This framework isn't just clinical, it's deeply human. If you're applying this in a specific setting, hospital, hospice, family care, I'd be happy to help tailor it to further or tailor it further. Avoiding mishaps is just as important as following the framework. Here are some common mistakes clinicians should steer clear of when using Dr. Boban's end of life conversation model. Rushing the conversation. Mistake jumping straight into prognosis or treatment options without establishing trust. Why it matters. Patients may feel overwhelmed or patients may feel overwhelmed or emotionally unprepared. Better approach. Start with empathy and support. Let the patient set the emotional pace. Using medical jargon. Mistake overloading patients with technical terms or vague uh, you euphemisms like comfort measures only. Why it matters. It can confuse or alienate patients and their families. Better approach. Use clear, compassionate language. Say, well, we'll focus on keeping you comfortable instead of palliative care. Avoid prognosis. Avoiding prognosis. Mistake being overly optimistic or vague to avoid upsetting the patient. Why it matters. It can lead to false hope or poor decision making. Better approach. Be honest but gentle. Acknowledge uncertainty while clearly outlining what it's like. Failing to explore values and fears. Mistake skipping questions about what the patient wants to avoid or fears most. Why it matters. You miss critical insights that should guide care decisions. Better approach. Ask open-ended questions like, what are you most worried about? Or what does a good day look like for you? 5. Not appointing a surrogate early. Mistake. Waiting until a crisis to identify decision maker. Why it matters. It can lead to confusion or conflict during emergencies. Better approach. Encourage patients to choose someone they trust while they're still able. Ignoring emotional responses. Mistake. Focusing only on facts and logistics. Why it matters. Patients and families need emotional validation. Better approach. Acknowledging feelings. Say things like, I can see this is really hard to hear. Treating it as a one-time talk. Mistake. Thinking one conversation is enough. Why it matters. Needs and emotions evolve. Better approach. Leave the door open. Revisit the conversation as the situation changes. If you'd like, I can help you role play or script one of these conversations to make it feel more natural and supportive. Absolutely. Here are examples of effective responses clinicians can use during end of life conversations aligned with Dr. Balban's framework and supported by expert guides. Start with starting with support. Goal: build trust and emotional safety. I want you to know I'm here to support you, not just medically, but emotionally and spiritually. Would you like to share what's been most important to you during this time? Is there anything you'd like me to know about your beliefs or values before we talk further? Clarifying roles and concerns. Goal: understanding fears and define decision-making roles. What worries you most about what's ahead? Is there someone you trust to help make decisions if you're unable to speak for yourself? Some people fear being a burden or losing control. Do any of these resonate with you? Making the prognosis clear. Goal: communicate medical reality with compassion. I wish I had better news. The treatments are no longer working, and we're seeing signs that your condition is worsening. It's okay. Take time to process this. I'll be here to answer questions whenever you're ready. Even though we can't change the outcome, we can make sure you're comfortable and supported. Okay. Last page for A, guys. Easing fears. Goal: reassure and guide through uncertainty. You won't be alone. We'll be with you every step of the way. Pain relief and comfort will be top priorities. Let's talk about what dignity means to you so we can honor that in your care. These responses aren't scripts, they're starting points for meaningful human-centered dialogue. If you'd like, I can help you tailor these to your specific role, settings, or patient population. Okay, guys, so that is A for you. I'll be back on shortly with B. For now, Gator Wellness. Take care, folks.